Imagine this. You're working at the reception of a busy clinic. A patient's relative calls in, claiming to be their spouse and asking for test results. You want to help, but can you legally share that information? That's where the Data Protection Act comes in.
The Data Protection Act was enacted to protect individuals' personal data, ensuring that organizations handle it lawfully and responsibly. In a healthcare setting, patient records, medical history, and even appointment details are considered personal data.
Before we go any further, let's break down some key terms from the Act. Personal data. Personal data is any information that can identify an individual, including names, addresses, medical history, and even biometric data like fingerprints and facial recognition. Data subject. The data subject is the individual whose personal data is being processed. In a hospital, every patient is a data subject. Data controller. This is the person or organization responsible for determining how and why personal data is processed. For example, a hospital acts as the data controller. Data processor. A data processor is any individual or company that processes personal data on behalf of the data controller. A classic example is an outsourced medical billing company handling patient invoices. Let's look at a real-life example. A nurse transfers a patient list to a USB drive to share with a specialist. If that USB is lost or stolen, that's a data breach. Under the DPA, failing to protect patient data can lead to serious legal consequences.
I need a copy of my medical records. How do I get it?
Under the DPA, you have the right to access your personal data. You can request a copy of your records, and we must provide them within 30 days.
Data subjects have the right to access their data, request correction of inaccurate data, prevent processing of their data in certain circumstances, be informed about how their data is being used.
As data controllers, we must ensure patient information is handled legally. That means data must be processed fairly and lawfully. 2, data should only be used for its intended purpose. 3rd, data should not be kept longer than necessary. 4th, security measures must be in place to prevent breaches. Failing to comply with these rules can lead to penalties, including fines and legal action.
Common mistakes and how to avoid them. Mistake number 1, sharing patient information without verifying identity. Solution: always confirm identity before sharing sensitive data. Mistake number 2, using weak passwords or leaving computers unlocked. Solution: use strong passwords and lock screens when stepping away. Mistake number 3, discussing patient details in public areas. Solution: always ensure conversations about patient health happen in private.
The Data Protection Act is here to protect both patients and healthcare workers. By following these guidelines, we ensure trust, security, and legal compliance. Understand the key definitions, respect patient rights. Follow the obligations of data controllers. Avoid common data protection mistakes. Now that you understand the basics of the Jamaica Data Protection Act, you're better equipped to handle patient data responsibly. See you in the next session.